Welcome everybody. Thank you for being here for our special update on the coronavirus. We're here with our resident expert and Chief Medical Officer, Dr. Alberto Garoli, to find out all about what's happening right now, how we can protect ourselves, how we can prevent this from happening. Dr. Garoli, welcome to the conversation. I'm going to jump straight into this. Can you share with us, what is the coronavirus? What do we need to know about this right now?
A coronavirus is a typical virus that infects millions of people every year. And the particular signs that these coronaviruses give are the signs of flu. The problem we're having with this strand is that it's a new type. It's called a new coronavirus, dubbed COVID-19 because it was discovered in 2019.
Thank you. And how is this transmitted? What do we need to be aware of right now? What is, how does this go from one person to the other? I hear it's very, the panic, the epidemic, the pandemic that's happening. How is this transmitted?
Generally, all these coronaviruses are transmitted from person to person or from surface. The main transmission medium is droplets of fluids. So speaking to at a close distance or contact with droplets from glasses are the typical transmission.
Got it. And so what precautions should we be taking right now to avoid or to minimize our exposure?
The most important parts to protect are the mucosa of the face, so nose, eyes, and ears. And one of the simple strategies will be not to touch your T-zone, so avoid eyes, nose, and mouth with your fingers, especially if you've been out and you hadn't had the chance to wash your hands. And the surgical masks are not particularly recommended, but the cleaning of your mucosa is. This virus is also weak, so we need just to take the temperature of surfaces of your face or hands above 21 degrees.
Okay, thank you. And so what, I guess, what precautions should we be taking right now? You know, in terms of masks, in terms of going out in public, you know, in terms of, you know, anything to do with exposure to other people, friends, family, schools, whatever. What do you advise us right now? What precautions should we be taking?
At the moment, the precaution that the governments are taking, especially here in Italy, is to avoid big gatherings or to avoid to participate concerts, going to movie theaters. So there's actually policies in place to avoid this contact. Most important thing would be, in our opinion, actually, rather than just staying away from the virus, is also to strengthen our immune system, which is a strategy that is not being pushed as much as avoidance.
Could you share with us a little bit about that? Because this is, you're right, something that we haven't really heard about. We've heard about the things to avoid. We haven't heard a lot about the proactive things we can do to either prevent or protect ourselves. So could you just share, like, in terms of the immune system, can you just give us a, you know, is the immune system a key to the coronavirus? And if so, what is it that we can do right now about our immune system or to strengthen our immune system?
What we have seen so far from these infections, apart from China, which is a different country, and we had different reactions here, is that most severe cases occurred in the population that goes between 75 years of age and 90 years of age. So older people with weakened immune system, and not so much in children, which means that this viral infections attack people that already have an impaired response to viral infection. The strategy will be to strengthen the immune system.
Fantastic. And are you suggesting that for those that are younger in age, maybe more resilient towards this virus, that if you're older, you're at a higher risk, if you're younger, you're at a lower risk for this?
That's the reality of facts that we're observing now. So younger people are much less influenced by the effects of this virus, whereas older people are the ones that have been hospitalized so far. This doesn't mean that the transmission of the virus doesn't take place. It does take place in asymptomatic carriers, which could also pass it to older people. So this is why the embargo, this is why the isolation of most groups and schools and so on, because they could carry the virus that then attacks older people that have a very weak response to viruses.
And so what if I have kids right now? Do I need to be more worried about my kids? Do they have a weaker immune system or a stronger immune system generally? If I have parents I'm caring for. So where does this sit for people with kids or people with parents right now? And what strategies would be really helpful for them?
The strategy they adopted here in Italy is not to have gatherings. So close contact with many people is advised against. And the other is more attention on hand and face hygiene for all the groups, but especially for people that could become carriers with several human contacts.
And so lots of us who've been out in the public, we obviously been living our lives. We may right now be carrying this virus. We just don't have symptoms. We don't know about it. What are some of the signs and symptoms that will show up for us? Like how would we know that we may have this in our bodies, or that maybe this may be around us or our families or our friends right now?
The only way to be certain will be through a real-time polymerase chain reaction, the PCR test through the swab, and that will detect the RNA virus and confirm there is an infection. Some cases were checked because of their symptoms. Initially, they had cough, maybe fever. They were tested and they were positive. Many other people were affected by the flu symptoms, tested and were negative. So it doesn't mean that this is the only virus that could cause important infections. It is always a good idea to be protected from all sorts of flu viruses, including coronaviruses, paramyxoviruses. So it's a good opportunity to strengthen the idea that we need to be very careful with the hygiene of our hands and face, especially when in contact with other people. And we need to start thinking that the best strategy for all the infections is not to avoid everything, but to strengthen the immune system.
Thank you very much. It's really important information. Could you just share with us even more detail on strengthening the immune system? Could you give us some specifics? So right now, if we're sitting at home watching this, wherever we are, what's some really practical steps we can take? I know that you're an expert here in the personalized medicine aspect. Is there some specific foods that are going to help increase things in our body that will help strengthen our immune system? Is there any supplements that we should be considering taking? Can you just give us a few key takeaways here of what we could do right now?
Yes, we already used some of the supplements. We know being able to neutralize viral particles that then impair the lung function. And one of those is the Astragalus membranaceus. The Astragalus is a plant that was originally used for fatigue and for chronic infection in patients that had a lower response. And it is working very well with these patients so far. The other is watercress, Nasturtium officinalis, which is known to be containing isothiocyanates, particular substances, sulfur-based substances that have antimicrobial activity. And the other one is the Raphanus sativus, generally used in wasabi. Most people know it as the base of wasabi, but it was the most used substance for 2,000 years in the world. And we know today it has an antiviral effect. Other substances that are readily available in our foods are zinc-containing foods, like oysters, beef, and chicken. They all contain a good quantity of zinc, which is an immunostimulant as general, but it's also helping us to be more protected. And the other is elderberry juice, elderberry extract. They will all have this particular activity, which is a stimulant for our macrophagic activity, and it will be a sort of a strengthening prevention for our immune system to be able to locate infectious viruses like H1N1 and influenza virus.
Amazing, thank you. So foods containing zinc, foods containing sulfur, elderberry extracts. I know that you've been working very hard for many years on actually producing supplements that help this exact thing. And I know this has been, you've been overwhelming demand for that. So we're going to pop a link below wherever you're watching this right now so that you can actually go ahead and order that if you want to take some direct action to prevent and to protect your immune system and strengthen your immune system, I should say, from coronavirus and other various viruses that are out there. So Alberto, just back to the day-to-day nature of this. So should we be, I understand it's maybe okay to go in the public, not with lots of people. We got to eat, right? So should we be going to supermarkets? Should we be like ordering in for takeaway? Is that even safe? If somebody's got coronavirus and they're preparing our food and it's getting delivered to us, is that a risk? Could you just share with us what's some tangible tips that you might give us right now? Is takeaway a good idea for now and we should just be staying at home? Is going to the supermarkets okay? I know there's been a lot of rush and a lot of clearing of shelves in supermarkets, for people bunkering down. So could you give us just a couple of tips there?
Yes, I think from the policies that we have seen applied in the last 15 days in Italy particularly, and in Europe, the most important part will not be what we eat, because the digestive system will have a way to pre-digest and transform any viral substance present. But the most important areas of our body that is vulnerable to viral penetration is the mucosa of the nose, eyes, and throat. So we would need to be more careful in environments that are not clean, like trains, for instance, or where there's forced ventilation. And this porous dust in very populated environments could be carrying more viral particles than a meal. So restaurants, for instance, and bars haven't been closed for that reason, because of the lower possibility of transmission through food. But schools have been closed, and areas where lots of gatherings, where people are in close contact, have been in a way discouraged, so that this close contact with people is less probable. And that's the main rule they adopted, and the World Health Organization is pushing in Europe at the moment.
Fantastic. What about water? Is there a risk for this to be transmitted through water? Is there something I need to be considering at home right now? Should I be drinking bottled water? Should I be buying a filter? Could you share with me a little bit about that?
No, the institutes and the committees of scientists haven't quoted water as one of the carriers. So the most important thing that we need to consider is always what kind of contact we have with other people in front of us. And so, of course, if we have a glass of water and we're amidst a crowd of people around us, some of the droplets of other people could go on the glass, and then we can touch our face. But the most important fact to know is the type of transmission through droplets and touching surfaces, rather than just drinking or ingesting through the stomach these substances. Most important thing is human contact, nose, mucosa of the nose, mucosa of the throat, easily penetrable by the virus. So everything else other than the contact with other people that might carry this virus is not advised against at the moment.
Thank you. And just back to the, I guess, a final aspect, the medical nature of how this presents. Some of us may be carrying this right now. We're asymptomatic. We don't know we've got it. Some of us also may not have the coronavirus at all, but we may have body aches. We may have fevers. We may have symptoms that are similar to that, just as part of our standard response to the flu and other things that are happening. What are we advising that we do or don't do about that? So if somebody has a fever, I know there's a lot of different perspectives from a medical perspective and a natural perspective. What are you sort of suggesting for us? Is a fever good for us right now for the natural way that it rises our temperature to try and cure what's there? Do we want to be taking some Tylenols and fever reducers from medications to try and reduce that if we have symptoms? What's the best way for us to play this out? Do we want to be taking extra electrolytes to make sure that we're where we need to be from a state of health? Could you just give us a little bit of maybe medical guidance if we do have some symptoms that are showing up? What's our best course of action right now?
So at the moment, what they're asking the population to do is, whenever they have symptoms that are relatable to a flu and are intense enough, to call a number. So they're discouraging showing up in institutes or hospitals or even private clinics. They provided a number to call. The person will call and receive information on what to do. Wherever the situation is controlled by the government, it is important to follow those rules because they are studied to contain traffic of people that might gather, for instance, in the wards of a hospital, then causing the spread of infection. Then whenever the information are given, one would follow that, and then if asked to show, they will take the swab and will assess the type of infection through PCR. Very often it could be negative. If positive, they will trace the story of this patient as they have done so far. So if negative, just a normal care was given for the flu. If positive, they were tracking the experience and the habits of this person to understand whether there was a contact with many or several or few people before, because this would mean the person is positive now and other people could be in touch. So sometimes they isolate areas because so many positive cases are found.
Amazing. Thank you for this incredible information, Dr. Garoli. If you're part of our community, which I'm sure you are if you're listening to this right now, we have an incredible little 10-day health and immune booster that may be a great idea for you if you're concerned about this in any way, shape or form, for you, for your families. We're really recommending people to be on the proactive here. And this is something that, as we're sharing here, there is a lot you can do about this. And the actual thing to do about this is to strengthen and help your immune system to be able to protect yourself and prevent this from happening. So please go ahead and check out some of those links. We'll put them below too, wherever you're watching this video. Please go ahead and check out Dr. Alberto Garoli's supplement that you can actually go and order right now, if that's something you'd like. And that's there may be a back order on those from what I understand, Dr. Garoli. They're pretty popular right now. So there is a lot you can do. Thank you so much for the information here today, Dr. Garoli. I really appreciate your time.
Yep.
I think this is sorry, go
just
ahead.
wanted to add one more information, Matt. Sorry to interrupt.
No.
And that is not to panic, but to look at reliable sources of information, because panic and fear and confusion can sprout out of wrong information. So look only at reliable information.
Thank you. It's a really important point, and that's the intention of this right now, to be able to share some direct facts with you from somebody who has all the knowledge and working knowledge of the body, of physiology, anatomy, and biochemistry, to understand what's happening. So thank you very much for the tangible tips that we can be implementing into our lives right now, the things that we can do to prevent and to protect ourselves from the coronavirus and many other things. I hope this has been informative for you. If you have any further questions, please get back to us wherever you're watching this, and otherwise feel free to email medical@ph360.me. So once again, thanks so much, Dr. Garoli, for your insights, for your genius, and for helping all of us stay safe and healthy in all of our daily lives. Much appreciated. And all of you, thank you for dialing in. If there's anything we can help you with, let us know. And otherwise, we certainly recommend go check out our Healthy Immune Booster and some supplement links that will be attached to this as well. So thank you all. Stay safe, stay healthy, and look forward to seeing you again soon.
Thank you.